Begin, let's start talking about where we currently are at in terms of Michigan response to the COVID-19 pandemic. Dr. Bagdasarian, can you talk about the current phase that Michigan recently entered in the fight against COVID?
Hi, this is Natasha Bagdasarian, and yes, I'm happy to talk about that. We're in a relatively good place right now in the pandemic. The question is how long this will last. So if I can just paint the picture, we recently went through a surge of Delta variant, and that was followed very closely by the Omicron variant surge. And so we're in a place now that is relatively safer than how things have looked for the last several months. And what that really means is that our case rates are down. They're down all across the state and really in most parts of the country right now. But it also means that our health systems are less stressed. And that's been a big problem. That was a big problem for us in the fall and the winter, where our health systems were really feeling the strain of COVID. So we are in a better place in terms of case rates, in terms of the type of testing that's going on and how many people are testing positive. And then, of course, in terms of how our health systems are faring. When I say it's unclear how long this will last, I say that because we're in what we're calling a recovery period. This is a period where our community members should feel relatively safer than they have for the last several months. But it doesn't mean the pandemic is over, nor does it mean that we are out of the woods. What we're doing at the moment is looking around us, looking at other states and other countries, and doing what I'm calling horizon scanning and looking for the next threat here to us in Michigan. And that could be from a change in the weather, where we would expect to see increased cases. It could be when schools reopen in the fall, or it could be a variant of concern. And so we're in this lower risk period, but there will be a time where we come out of this lower risk period and where we start to see more cases again.